cough is a symptom, not a disease. It can be caused by many conditions like colds, allergies, smoking, postnasal drip, and acid reflux.
Wind-face respiratory infections. Most common. Common cold, mild cough with runny nose and sore throat. A flu, influenza, fever, body aches, dry cough. Acute bronchitis, persistent cough with mucus. A pneumonia, severe cough with fever and chest pain. Backhand index pointing right, these are the most frequent causes. Chronic lung diseases. Asthma, wheezing plus cough, often at night. A COPD, long-term cough in smokers. A chronic bronchitis, daily productive cough. A tuberculosis, TB, cough 2 weeks, sometimes blood. Sneezing face allergy and upper airway causes. Allergic rhinitis, dust allergy. A post-nasal drip. A sinusitis. Backhand index pointing right, usually with sneezing, throat irritation, or seasonal pattern. Fire other important causes. A GERD, acid reflux, cough worse after meals or lying down. A smoking, chronic morning cough. A heart failure, cough with breathlessness. A lung cancer, persistent cough, weight loss, blood in sputum. A ACE inhibitor medicines, BP drugs like enalapril, dry cough. Triangular flag when cough is dangerous, see a doctor urgently. A cough lasts more than 2 to 3 weeks. A blood in sputum. A high fever. A weight loss. A severe breathlessness. A night sweats.
Cough can be caused by many conditions, from asthma to GERD. Watch the full series for deep dives into each cause.